Have you noticed subtle yet concerning changes in a loved one over the past year? Many assume that aging follows a steady path, but the truth is, the body often gives quiet warnings long before the final stage of life. These signs may seem minor at first, weight loss, fatigue, or moments of forgetfulness, but they often hold a deeper meaning. What if recognizing them now could help you prepare emotionally and practically for what's ahead? In this guide, we'll explore 5 key indicators that signal an elderly person may be nearing their final year, helping you make every moment count. If you've noticed a loved one losing weight without trying, it might seem like just another part of aging. Their clothes start fitting looser, they eat smaller portions, and their once hearty appetite begins to fade. Many families dismiss these changes, assuming they're normal or temporary. But in reality, unintentional weight loss is often one of the earliest signs that the body is beginning its final transition. Weight loss is not just about appearance. It's a message from the body that something deeper is happening. The sooner you recognize this sign, the better prepared you can be to provide comfort, care, and emotional support during this time. As we age, some changes in appetite and metabolism are expected. However, when an elderly person starts losing weight rapidly and without explanation, it usually means their body is struggling in one or more ways. Difficulty absorbing nutrients. The digestive system slows down, making it harder for the body to process food efficiently. Even if they eat, they may not be absorbing enough nutrients to maintain muscle and energy levels. Loss of muscle mass. The body begins breaking down muscle for energy, leading to weaker mobility, increased fall risk, and overall frailty. Decreased appetite. The body naturally reduces hunger signals when it senses a decline in function, causing the person to eat less over time. Chronic illness or underlying conditions. Conditions such as cancer, heart failure, kidney disease, or undiagnosed infections often cause unintentional weight loss long before other symptoms become obvious. At first, these changes may seem minor, but over time, weight loss becomes more noticeable, and the person may start experiencing fatigue, difficulty moving, and reduced interest in food altogether. Many elderly individuals in their final year of life experience a gradual detachment from food. Meals that once brought them joy may. This isn't just a matter of preference. It's the body's way of signaling that it no longer needs as much energy. Family members often try to encourage eating by offering favorite meals or high-protein shakes, hoping to reverse the weight loss. While this can help in the short term, it's important to understand that forcing food won't change the body's deeper transition. Instead, the focus should shift from quantity to comfort, offering easy-to-eat, nutrient-dense foods that feel good for them, rather than trying to force large meals. Weight loss can also have an emotional impact. Many elderly individuals feel frustrated, self-conscious, or even embarrassed about their changing appearance and declining strength. They may start withdrawing from social situations or avoiding meals altogether because eating feels like a burden. As a caregiver or family member, this is where patience and understanding become essential. Instead of focusing on how much they eat, focus on how they feel. If you notice a loved one experiencing rapid or unexplained weight loss, here are some ways you can help. Monitor their eating habits. Pay attention to changes in their appetite, meal portions, and interest in food. Offer small, easy-to-eat meals. Instead of large plates, provide soft foods, soups, or smoothies that are easier to consume. Encourage hydration. Dehydration can contribute to appetite loss, so encourage small sips of water, tea, or broth throughout the day. Avoid pressuring them to eat. While it's natural to want them to eat more, forcing large meals can cause discomfort or frustration. Instead, focus on what feels best for them. Consult a doctor. If weight loss is significant and unexplained, medical guidance can help determine if there's an underlying condition that needs attention. Weight loss isn't just about physical decline. It's often the body's way of signaling a shift in priorities. Just as fatigue and weakness follow weight loss, this stage is part of a larger transition. Recognizing it early gives you the chance to adjust care, provide comfort, and focus on making every moment meaningful. Rather than trying to reverse the inevitable, the best thing you can do is ensure their final stage of life is filled with warmth, dignity, and love. If unexplained weight loss is one of the first signs that an elderly person may be approaching their final stage of life, then extreme fatigue and weakness often follow closely behind. The two are deeply connected. When the body isn't absorbing nutrients efficiently, it struggles to maintain strength and energy levels. What once seemed effortless, like getting out of bed or taking a short walk, becomes a challenge. If you've noticed a loved one sleeping more, feeling too exhausted to engage in daily activities, or withdrawing from things they once enjoyed, it may be a sign that their body is slowly winding down. Fatigue is more than just feeling a little tired. It's a deep, persistent exhaustion that doesn't improve with rest. While some assume this is just part of aging, extreme fatigue often means that the body is conserving its limited energy as vital functions begin to slow. One major reason for this exhaustion is a decline in metabolic function. The body no longer processes food efficiently, meaning it gets less energy from meals. Combined with weight loss and reduced muscle mass, this leads to profound weakness, making even the simplest tasks feel overwhelming. Climbing stairs, cooking, dressing, or even holding a conversation can become draining. Additionally, as circulation weakens, the heart doesn't pump blood as efficiently, and oxygen levels in the body drop. This results in muscles receiving less oxygen, further contributing to feelings of fatigue and unsteadiness. If your loved one is experiencing frequent dizziness, shortness of breath, or difficulty standing up without support, it may be a sign that their body is struggling to keep up with even minimal. Fatigue doesn't just affect the body, it also takes an emotional toll. Many elderly, you may notice them avoiding conversations, declining invitations, or no longer engaging in hobbies they once loved. At first, this can lead to a cycle of isolation, where this is where your presence becomes incredibly important. Instead, watching someone you love grow weaker can be painful, but understanding what's happening allows you to offer the right kind of support. Here's how you can help. Respect their need for rest. Instead of encouraging them to push through exhaustion, allow them to rest when needed. Their body is telling them what it needs. Make daily activities easier. Help them conserve energy by simplifying daily tasks. Arrange seating in convenient places, use adaptive tools, or offer assistance with dressing and eating. Encourage small moments of engagement. Instead of tiring activities, try reading to them, playing soft music, or having short conversations that don't require much effort. Ensure they're comfortable. Fatigue often comes with muscle aches and discomfort, so providing soft pillows, warm blankets, and a peaceful environment can make a big difference. Talk to a doctor if needed. If fatigue suddenly worsens or is accompanied by pain, shortness of breath, or confusion, it's important to rule out medical causes like heart or lung issues. Just like with weight loss, extreme fatigue is the body's way of signaling change. When an elderly person starts sleeping more, moving less, and struggling with everyday tasks, it's not just about growing old. It's a natural part of the body's transition. Instead of focusing on what they can no longer do, shift the focus to making their remaining time as peaceful and meaningful as possible. This is a time for quiet moments, heartfelt conversations, and gentle reassurance that they are not alone. If you are still watching this video and found these insights valuable, please comment below to let me know you are here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any of our videos. Your support helps us continue to create good content to inform and inspire you. As the body slows down and energy levels drop, another significant change often emerges: cognitive decline and emotional withdrawal. If extreme fatigue and weakness make it harder for a loved one to stay physically active, cognitive changes can make it even harder for them to stay mentally and emotionally engaged. You may notice they seem more forgetful, struggle to follow conversations, or appear confused in familiar situations. Some may even begin withdrawing from loved ones, not because they don't care, but because their mind and emotions are shifting as part of the body's natural transition. These changes can be subtle at first: a misplaced item, a forgotten appointment, or difficulty finding the right words. But over time, they may become more noticeable, leading to moments of disorientation, repeated stories, or even forgetting the names of close family members. For many, this is one of the most painful signs to witness. Seeing someone you love slowly lose touch with reality can feel like losing them before they are physically gone. However, understanding why these changes happen can help you respond with patience, compassion, and reassurance. Just like the body requires oxygen and nutrients to function, so does the brain. As circulation weakens and organ function slows, the brain doesn't receive the same level of oxygen and nutrients it once did. This can cause memory lapses, confusion, and difficulty processing information. Additionally, extreme fatigue plays a role in cognitive decline. The brain, like the body, begins to prioritize energy for essential functions. This means that tasks requiring mental effort, like holding a conversation, making decisions, or remembering details, may become increasingly difficult. This is why a loved one may suddenly seem lost in thought, struggle to finish a sentence, or appear uninterested in things they once enjoyed. Cognitive decline is often accompanied by emotional withdrawal. Someone nearing the final stage of life may seem less engaged, speaking less, or spending long periods in silence. At first, this can be mistaken for sadness or depression, but in many cases, it's simply the brain's way of preserving energy. You might notice that they lose interest in conversations. They may respond with short answers or seem distracted even when you're speaking directly to them. Withdraw from social activities. Events that once brought joy may now feel overwhelming or tiring. Experience mood changes. Some become irritable or frustrated when they can't remember things, while others may seem unusually calm and detached. For families, this shift can be heartbreaking. It may feel like the person you knew is slowly slipping away. But rather than seeing this as a loss, it can be helpful to reframe it as a change in how they experience the world. Even if they don't always respond, they can still feel your presence. Even if they forget your name, they can still recognize love and comfort. While you can't reverse these changes, there are ways to make your loved one feel safe, supported, and at ease. Speak calmly and simply. Use short, clear sentences and avoid overwhelming them with too much information at once. Create a familiar environment. Keeping their surroundings consistent and clutter-free can help reduce confusion. Be patient with memory lapses. If they repeat stories or ask the same question multiple times, respond kindly rather than correcting them. Engage in gentle connection. Hold their hand, play soft music, or sit with them in comfortable silence. Sometimes presence speaks louder than words. Limit overstimulation. Loud noises, crowded spaces, or too much activity can feel overwhelming, so creating a peaceful environment is key. Just as extreme fatigue signals the body's need to conserve energy, cognitive decline is the brain's way of gradually detaching from the physical world. Instead of focusing on what is lost, this can be a time to cherish simple, quiet moments of connection. Even when words fade, emotions remain. Even if they don't remember everything, they can still feel love, warmth, and care. If you've noticed your loved one withdrawing, becoming more forgetful, or struggling to stay engaged, know that this is not their fault, nor is it something you can fix. Instead of trying to bring them back into the present, meet them where they are. Provide comfort, offer reassurance, and remind them, through actions more than words, that they are not alone. As cognitive decline and emotional withdrawal set in, another critical sign often emerges: a weakened immune system, leading to frequent infections and slow healing. If your loved one seems to catch every cold that goes around, takes much longer to recover from minor illnesses, or develops sores that don't heal as quickly as before, these are more than just isolated health issues. They signal that the body's ability to repair and defend itself is breaking down. At first, these infections may seem mild: a lingering cough, a urinary tract infection, UTI, or a small wound that takes weeks to heal. But over time, they become more frequent, harder to treat, and more physically draining. Recognizing this pattern is crucial because it indicates that the body is losing its ability to fight back. Understanding why this happens can help you shift your focus from aggressive treatment to comfort and care. The immune system, like all other bodily functions, requires energy, circulation, and proper nutrition to function effectively. As we discussed earlier, significant weight loss and extreme fatigue mean the body isn't absorbing enough nutrients, leading to weaker muscles and lower energy reserves. But this also affects the immune system, making it less effective at recognizing and fighting infections. Here's why elderly individuals in their final stage of life are more prone to infections. Poor circulation. As the heart weakens and blood flow slows, the body struggles to send white blood cells, which fight infections, to affected areas quickly. This leads to slow healing and prolonged illnesses. Lowered nutrient absorption. The immune system relies on nutrients like vitamins C, D, and zinc to function properly. But with a slowing metabolism and reduced appetite, the body no longer receives the nutrients it needs to maintain strong immunity. Decreased energy for defense. Fighting infections takes energy, but the body is already conserving its remaining energy for vital functions. This means that even minor infections can linger and cause greater complications. Weakened skin barrier. The skin, the body's first line of defense against bacteria, also weakens. This makes elderly individuals more prone to bed sores, wounds, and skin infections that take longer to heal. Over time, these factors work together to make infections more frequent, more severe, and more resistant to treatment. While infections can happen at any age, elderly individuals in decline often experience recurring or prolonged infections. The most common ones include urinary tract infections, UTIs. These can cause pain, confusion, fever, and even hallucinations in elderly individuals. Pneumonia and respiratory infections. A simple cold can quickly escalate into pneumonia due to weakened lung function. Skin infections and bed sores. Small cuts and bruises take longer to heal, increasing the risk of infections like cellulitis. Oral infections and thrush. A dry mouth and weakened immune system make it easier for bacterial and fungal infections to develop. These infections often don't present the way we expect. Instead of high fevers, elderly individuals may just seem more tired, confused, or uninterested in food. That's why paying attention to subtle changes is essential. For many elderly individuals, recurring infections can be frustrating and exhausting. They may feel helpless, as they seem to be in and out of treatment constantly. You may notice them becoming more withdrawn, refusing medications, or simply losing the will to keep fighting illnesses. For families, this stage can be emotionally difficult. The instinct is often to push for more antibiotics, more hospital visits, and more treatments. But at a certain point, the focus needs to shift from curing to comforting. Instead of asking, how do we fix this? The more important question becomes, how do we keep them comfortable and at peace? Rather than exhausting their remaining strength on aggressive treatments, focus on keeping them as comfortable as possible. Keep them hydrated. Dehydration weakens the immune system further, so encourage small sips of water, tea, or broth. Maintain skin health, moisturize dry skin, reposition them frequently if they are bedridden, and treat wounds promptly to prevent infections. Improve oral hygiene. A clean mouth can help prevent painful infections and improve overall comfort. Minimize stress on the body. Hospital stays and strong medications can be overwhelming, so discuss gentler treatments that prioritize comfort over aggressive intervention. Monitor subtle signs of infection. Watch for unexplained fatigue, confusion, loss of appetite, or sudden changes in behavior, as these can indicate underlying infections. Just as weight loss, extreme fatigue, and cognitive decline signal that the body is slowing down, frequent infections and slow healing are signs that the immune system is shutting down. While it's natural to want to fight every illness, at a certain point, comfort becomes more important than cure. Instead of focusing on prolonging life at any cost, this is a time to prioritize quality of life. Ensuring that your loved one is hydrated, pain-free, and surrounded by warmth and love is often the greatest gift you can give during this stage. If you are still watching this video and found these insights valuable, please comment below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any of our videos. Your support helps us continue to create good content to inform and inspire you. As the immune system weakens, leading to frequent infections and slow healing, another significant change often emerges: altered breathing and circulation patterns. These shifts indicate that the body is slowing down, redirecting energy to essential functions while reducing circulation to less critical areas. Families may notice their loved one's breathing becoming irregular, extremities feeling cold, or skin taking on a bluish or mottled appearance. While these changes can be distressing to witness, understanding them can help you focus on comfort rather than fear in your loved one's final days or weeks. As the heart and lungs weaken, the body naturally reduces circulation to the hands, feet, and skin, prioritizing blood flow to vital organs. This leads to cold extremities and a pale or bluish tint, especially around the fingertips, toes, and lips. Breathing patterns also change due to declining lung function. Many elderly individuals experience Cheyne-Stokes respiration, a cycle of deep breaths followed by pauses. Others may have shallow breathing or exhibit a death rattle, caused by mucus buildup in the throat. These changes often indicate that oxygen levels are dropping, but they are not necessarily painful. You may notice the following signs as circulation and breathing decline: cold hands, feet, and nose, even in a warm room; skin turning bluish or mottled, especially in the fingers and toes; irregular breathing, with long pauses or cycles of deep, rapid breaths followed by shallow ones; a weak or irregular pulse that becomes harder to detect; a persistent cough or gurgling sounds caused by mucus buildup in the throat. At this point, medical intervention is rarely helpful. The focus shifts to ensuring peace and comfort. Here's how you can help. Adjust their position. Keeping them slightly upright can ease breathing discomfort. Use a humidifier or offer ice chips. This helps soothe dry airways. Keep their hands and feet warm. Soft blankets or gentle massages can provide comfort. Minimize stimulation. A calm, quiet environment with soft music or a gentle voice can bring reassurance. Just as weight loss, fatigue, cognitive decline, and frequent infections signaled the body's gradual slowing, changes in breathing and circulation indicate the final stage. This is a time to be present, hold their hand, and offer love. Even if they can no longer respond, they can still feel comfort and peace in your presence. If you found these insights valuable, please comment below. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss our videos. Your support helps us continue to create meaningful content. Life teaches us that change is inevitable, and in our final stages, the body gently signals its transition. Recognizing these signs, weight loss, fatigue, cognitive shifts, frequent illness, and breathing changes, allows us to focus not on prolonging life, but on making each moment meaningful. The greatest gift we can offer our loved ones isn't just medical care, but comfort, dignity, and presence. This journey is a reminder that love transcends words, actions, and even time. As we care for others, we must also cherish our own lives, embracing gratitude, connection, and the beauty of simply being together. Thank you for joining us today. We'd love to hear from you. Please share in the comments one insight you gained and how you plan to apply it in your life. Your feedback is invaluable and keeps us motivated. If you find this video helpful, don't forget to like, subscribe, and share. Your support enables us to continue creating content that informs and inspires. Thank you for watching, and we look forward to seeing you in the next video.